Hi guys, today we're going to be discussing an aspect of microbiology known as pathogenic gram-positive bacteria. We've got a group of 3 people, Mandy Moss, Savannah Owens, and Angela Olden. Before we begin discussing the actual diseases, we want to explain to you a little bit what pathogenic gram-positive bacteria is. In microbiology, there is a procedure known as a gram stain, which differentiates between 2 types of bacteria, gram-positive and gram-negative. Using that stain, gram-positive will show purple, whereas gram-negative will show pink. This is because the gram-positive has a thick layer of peptidoglycan in their cell wall that retains the dye better than the gram-negative, which makes them appear purple because the stain itself is crystal violet. The 3 diseases in this category, or the 3 bacteria that cause the diseases that we're going to be discussing, are Streptococcus pneumonia, Group A Streptococcus, and Staphylococcus. So first we're going to have Mandy Moss to discuss Streptococcus pneumonia.
In 1881, Louis Pasteur discovered this disease with pneumonia patients. The bacterium is a gram-positive coccus that is 0.5 to 1.2 in diameter. It forms short chains or pairs, and there's actually 92 different strains called pneumococci known to infect humans. Streptococcus pneumonia colonies grow for 24 hours, and they're 1 to 3 millimeters in diameter. They're round, they're mucus, unpigmented, and dimpled due to older cells. Colonies are alpha hemolytic on blood agar if grown aerobically, and beta hemolytic if grown anaerobically. Streptococcus pneumonia is a member of the pharyngeal microbes that affect the lungs, sinuses, and middle ear. Scientists still do not know the cause of the virus. Virulent strains have a polysaccharide capsule that surround it. The capsule is required for virulence. Streptococcus pneumonia inserts a chemical called phosphorcholine to help pneumococci into their cell walls. It binds to receptors on cells in the lungs, meninges, and blood vessel walls to engulf bacteria. The polysaccharide capsule and phosphorcholine help pneumococci to hide in body cells, which then can pass through the cells into the brain and into the blood. Pathogenic pneumococci secrete a protein called adhesion. This allows binding of cells to epithelial cells of the pharynx. Bacteria then can enter the lungs. The body only allows bacteria to enter the lungs binding of microbes with secretory active sites of IgA. The leftover antibody molecule binds to mucus, thus trapping the bacteria where it can take from the airways by ciliated epithelium. IgA protease is secreted by a bacterium which counteracts this defense, and this destroys the IgA and pneumolysin. Pneumolysin binds to cholesterol in the cytoplasmic membrane of ciliated epithelial cells that produce transmembrane pores that cause lysis of the cell. It also causes suppression of the digestion of endocytized bacteria by interfering with lysosomes. Streptococcus pneumonia grows in the mouths and pharynges of 75% of humans. This usually does not cause harm, but if it travels to the lungs, then it usually does cause disease. Pneumococcal disease is usually highest in children and the elderly. You have 2 conditions called that we're going to discuss right now, and it's sinusitis and otitis media. Streptococcus pneumonia can invade the sinuses and middle ear, which cause sinusitis. Pressure and pain is caused by the pus and the inflammation in these cavities, and this can occur in all ages. It is more common in children, however, because their auditory tubes are more narrow, which allow the flow of infected fluid from the pharynx into the middle ears. And here's 2 more conditions that can occur. It's called bacteremia and endocarditis. Streptococcus pneumonia can enter blood through cuts or lacerations from brushing your teeth too hard, chewing hard foods, or tissue. Bacteria usually do not enter the blood while having sinusitis or otitis media. Streptococcus pneumonia can invade and colonize the lining of the heart, which is called endocarditis, and the heart valves are usually destroyed when this happens. Streptococcus pneumonia causes a variety of diseases. Pneumococcal pneumonia is the most prevalent of all, which is about 85%. It develops when pneumonia is inhaled from the pharynx into the lungs, damage from a previous viral infection like having the flu or measles, and some other conditions like alcoholism, congestive heart failure, or diabetes mellitus can also cause it. The bacteria multiplies in the alveoli, and this damages the alveolar lining, allowing fluid, red blood cells, and white blood cells to enter. The white blood cells attack Streptococcus, and this causes inflammation and fever. The fever could be between 39 to 41 degrees Celsius, and severe chills could happen. You could have a productive cough and slightly bloody sputum and chest pain. Pneumococcal meningitis is what we're fixing to talk about now. Pneumococci can spread to the meninges by bacteremia while having sinusitis or otitis media, or after having neck surgery or trauma that opens a passageway between the pharynx and the subarachnoid space of the meninges. This usually affects children, and the mortality rate is up to 20 times that of meningitis caused by other microbes. We're going to talk about diagnosis, treatment, and prevention now. Medical technologists can identify pneumococci fairly quick by performing gram stains of either sputum smears or with a quelling reaction in which the anti-capsular antibodies cause the capsules to swell. Antibody agglutination tests are also used to identify specific strains. Sputum samples are often difficult to obtain of pneumococci because it has fastidious nutritional requirements, and cultures are sometimes overgrown by normal oral microbes. Streptococcus pneumonia is sensitive to most antimicrobial drugs. Adding a drop of bile to a colony can distinguish pneumococcal colonies from other colonies of alpha hemolytic strains. Penicillin is usually the drug for Streptococcus pneumonia. However, there are some penicillin-resistant strains that have developed in the last decade. Now we're going to have Angela come talk about Streptococcus.
Streptococcus is an assemblage of gram-positive cocci and is arranged in parasol chains. Unlike Staphylococcus, Streptococcus is catalase negative and it is anaerobic. Differentiation between these Streptococcus is differentialized between overlapping schemes, different classifications based on the reaction to antibodies to specific bacterial antigens, in many cell arrangement, and the hemolysis and the physical properties are all revealed by chemical tests. Streptococcus is divided into groups of A and U, K and V based on the bacteria's antigen. Streptococcus pathogens are able to survive as pathogens in the body based on two main structures such as the M protein, which is a membrane protein called M protein, which destabilizes the complement, thereby interfering with opsonization. The hyaluronic acid capsule is based on hyaluronic acid, which is normally found in the body. White blood cells may ignore bacteria, which are camouflaged by this type of capsule. Group A, Streptococcus secretes three distinct microgenic toxins that stimulate microphages and helper T cells to release cytokines that stimulate fever, a widespread rash, and shock. The toxins also cause blood capillaries to dilate, which produce a red rash, and there are known as erythrogenic toxins. Streptococcus myogens cause diseases when the normal competing microbiota are depleted, which enables the Streptococcus to gain a rapid foothold before antibodies are formed against them or when the immunity is impaired. These pathogens are not motile, which means they cannot move, and they do occur in chains of cocci. Streptococcus pathogens can spread via respiratory droplets or simply in a crowded classroom. Group A Streptococcus can cause many diseases depending on three things, which are the site of the infection, the strain of the bacteria, and the immune response of the person. I will begin by talking about 6 diseases that the Group A Streptococcus can cause. One is pharyngitis, scarlet fever, myoderma, and erysipelas, toxic shock-like syndrome, necrotizing fasciitis, and rheumatic fever. Pharyngitis is simply the inflammation of the pharynx and is typically known as strep throat. In this disease, the back of the pharynx appears red with swollen lymph nodes and pus covers the tonsils. Immediate diagnosis is important because it can be treated with antibacterial drugs. Fevers such as the scarlet fever and the rheumatic fever are both caused by Group A Streptococcus, and scarlet fever goes along with the pharyngitis when the infection involves a lysogenized strain of S. pyogenes. Following pharyngitis, paragenic toxins released by the Streptococcus trigger a diffuse rash that begins on the chest and spreads across the body. The tongue becomes red and the skin becomes slouchy. In rheumatic fever, the fever is left when the pharyngitis is basically left untreated and it damages the heart valves and the muscles. This disease is not directly caused by the group A Streptococcus, but it is caused by an autoimmune response in which antibodies directly against Streptococcus antigens cross-react with the heart antigens. Myeloma is a pus-producing lesion that usually occurs on the exposed skin, such as the face, legs, and arms. It is caused by direct contact with an infected person. After the pus-filled lesion breaks open, it forms a yellowish crush, which is very contagious, and scratching may cause the disease to spread because of bacteria in the skin. The erysipelas is caused from a streptococcus infection that involves other lymph nodes and trigger pain and inflammation, and is most seen in children, as you can see. The toxic shock-like syndrome is group A streptococcus, and it can spread to other places, leading to bacterium and other multi-system infections. The patient experiences inflammation at the site of the infection. They can experience pain, fever, chills, nausea, and even vomiting. It can also lead to organ failure or even organ shock. The necrotizing fasciculus is also known as the flesh-eating bacteria. It enters the body through the breaks in the skin and secretes enzymes and toxins that destroy tissues and destroy muscles and fat tissue. It can cause toxins to leak into the blood, which leads to organ failure or even death. When gram-positive bacteria is observed in short chains and containing specimens, it is assumed that this is a sign of one of the diseases mentioned earlier. Penicillin is very effective in treating the disease, and as far as necrotizing fasciculus, aggressive surgery is necessary. And as far as prevention, rheumatic fever cannot be treated directly, but the antibodies against M protein can provide long-term protection against S pathogens. And Savannah will tell you about Staphylococcus.
The third and final bacteria we're going to discuss that falls under pathogenic gram-positive bacteria is Staphylococcus. And what's neat about Staphylococcus is you're probably actually much more familiar with it than you realize. I say this because Staphylococcus is actually present on your body at all times. Bacteria belonging to the genus Staphylococcus are living and reproducing on the human body at all times. These microbes are usually harmless to people. However, under certain conditions, they may become pathogenic, causing minor to potentially life-threatening diseases. The structure and physiology of Staphylococcus. Staphylococcus, just as our other bacteria that we've discussed, are gram-positive, which means on a gram stain, they stain purple. This is because they have a thick cell wall of peptidoglycan which retains the stain better than the gram-negative cells. There's two major types of Staphylococcus. There's Staphylococcus aureus, which is the more virulent one. It's more likely to cause disease in patients. And then the second type of Staphylococcus we have is Staphylococcus epidermidis. Staphylococcus epidermidis is usually not harmful to people. It's actually the one that's mostly present on your body, but it can be an opportunistic pathogen if a patient is immunocompromised for some reason. Pathogenicity. A staph infection, as we commonly call it, results when staphylococci gain entry to the body after breaching the body's physical barriers, which would be like our skin or our mucous membranes. The pathogenicity of Staphylococcus results from three features. They have structural defense against phagocytosis, they produce enzymes, and they produce toxins. We're going to talk about each of those in detail, beginning with the structural defense against phagocytosis. So, when your body detects something inside it that is not supposed to be there, it automatically tries to defend itself by getting rid of the external pathogen. But Staphylococcus actually protects itself from being phagocytized by producing these three things. First is protein A. Protein A actually binds to the stems of antibodies, which inhibits their ability to enhance phagocytosis. And this is a characteristic mostly of the Staphylococcus aureus. The second characteristic would be the production of coagulase. Coagulase converts fibrinogen into fibrin molecules that form clots around the bacteria, hiding it from the pathogenic bacteria. So what actually happens is the bacteria produce the coagulase, and then it tells the blood to form a plot around it, and that hides it from your leukocytes, so they're unable to destroy it and rid it from your body. This is also most prevalent in Staphylococcus aureus. The third characteristic that prevents them from being phagocytized is the slime layer. This inhibits chemotaxis and endocytosis by leukocytes. It also facilitates an attachment to external surfaces such as catheters, shunts, or synthetic joints. This one's important because the majority of staph infections occur because the Staphylococcus is actually introduced into your body from external surfaces such as catheters or shunts or synthetic joints. And this is true for both Staphylococcus aureus as well as Staphylococcus epidermidis. The second way the bacteria is able to evade being phagocytized is its production of enzymes. It produces 5 enzymes we're going to discuss. There's the cell-free coagulase, which triggers the blood clotting, as we discussed earlier, where the blood clots around the bacteria and prevents it from being recognized by leukocytes. It also produces hyaluronidase, which breaks down hyaluronic acid, which is a major component of the matrix between cells. By doing this, it's actually able to travel between cells easier and spread the bacteria or the infection. There's also staphylococcus, which dissolves fibrin threads and blood clots, allowing the bacteria to free itself. So after the bacteria hides itself in the blood clots, it's able to free itself once it's traveled where it needs to go. Lipase, which digests lipids, allowing staphylococci to grow on the surface of your skin. And penicillinase, which breaks down penicillin, allowing staphylococci to resist treatment to certain antimicrobial drugs. Epidemiology. Staphylococcus is capable of causing multiple medical problems depending on site of infection, the immune state of the patient, and the toxins and enzymes the specific strain of the species of bacteria secretes. Staphylococcus diseases may be one of 3 things. It could be non-invasive, cutaneous, or systemic, and we're going to discuss each. Non-invasive diseases. Staphylococcus aureus is a common cause of food poisoning, or more specifically, food intoxication. For food to become capable of curing this illness, it must be left at room temperature or longer for the bacteria to grow, reproduce, and secrete toxins. Warming or reheating inoculated food may kill the bacteria, but it will not kill the toxins. Contaminated foods may not look or taste unusual. So food poisoning doesn't actually result from the Staphylococcus bacteria itself, but rather the toxins produced by the Staphylococcus. And so regardless of what you do to the food, if the bacteria has already produced the toxins within it, you cannot destroy them, and it will make you sick if you eat it. Symptoms of food intoxication include nausea, severe vomiting, diarrhea, headache, sweating, abdominal pain, and these symptoms usually appear within 4 hours following ingestion and only last about 24 hours or less. Staphylococcus is also capable of causing cutaneous diseases, 2 of which are going to be the staphylococcal scalded skin syndrome. This consists of reddening of the skin that typically begins near the mouth and then spreads to your entire body. It's followed by large blisters that contain clear fluid that lack bacteria and white blood cells. Then within 2 days, that outer layer of the skin peels off in sheets, and you can kind of see what it looks like. It's not pleasant. Another cutaneous disease would be impetigo. This consists of smaller, flattened red patches on the face and limbs, commonly in children whose immune systems are not fully developed. Patches develop into pus-filled vesicles that then crust over. Unlike Staphylococcus scalded skin syndrome, which we discussed here, the pus is filled with bacteria and white blood cells. Cutaneous diseases continued. The last cutaneous disease was the folliculitis. It's an infection of a hair follicle in which the base becomes red, swollen, and pus-filled. And there's 3 types. A stye, which occurs at the base of your eye, and there's the picture. A furnicle or a boil, which is large, painful, raised nodular extension of folliculitis into surrounding tissue. That's the one on the bottom. And the worst one would be the carbuncle, which occurs when several furnicles coalesce, extends deeper into the tissues, triggering fever and chills. So it actually just extends further into your body through different layers of tissue. And it can make you sicker, triggering the fever and the chills. Systemic diseases. Both Staphylococcus aureus and Staphylococcus epidermidis have the potential to cause a wide variety of potentially fatal systemic infections when they're introduced into deeper tissues of the body, including blood, heart, lungs, and bones. Staphylococcal toxic shock syndrome. This occurs when strains of staph that produce TSS toxin grow in a wound or an abraded vagina. The toxin is then absorbed into the blood. Symptoms include fever, vomiting, red rash, extremely low blood pressure, and loss of sheets of skin. Staphylococcal toxic shock syndrome is fatal in 5% of patients, and because it does occur most commonly in menstruating women, men can obtain it, but menstruating women are most common. Bacteremia is another systemic disease. This one's extremely dangerous because it's when the bacteria enters your blood. And once the bacteria has entered your blood, it has access to the rest of your body. Once the bacteria enters the blood from the site of infection, it's able to spread to all your other organs, which could then become infected. Nosocomial infections account for about half of all cases of staphylococcal bacteremia, which means that the majority of people who get bacteremia actually get it while they're in the hospital. More systemic diseases consist of endocarditis, pneumonia, empyema, and osteomyelitis. Each of these can result from the bacteremia itself, as the bacteria in the blood travels to your heart, your bones, and even your lungs. Diagnosis, treatment, and prevention. Physicians are able to diagnose staphylococcal infections by detecting grape-like arrangements of gram-positive bacteria isolated from pus, blood, or other fluids. So basically, it's always a microscopic test, and they can look at it and tell you if it's a gram-positive bacteria. As far as treatment goes, initially penicillin was always used to treat staphylococcal infections, but the bacteria itself adapted and became resistant to the penicillin. So they now use methicillin, which worked for a while, but unfortunately methicillin-resistant Staphylococcus aureus has become a major problem in the United States. More people die in the United States from MRSA than from HIV. Now vancomycin has been used to treat MRSA infections, but the bacteria has begun adapting to this drug as well, resulting in vancomycin-resistant Staphylococcus aureus, which is a major concern among medical professionals today. The major priorities in the medical field to prevent these staph infections are just proper use of aseptic techniques, cleansing all your surgical materials or catheters or indwelling needles, anything that's going to be in a patient for a long time, and of course hand washing.